Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the last two previous videos, we have discussed lots of the important, and the very, and again very important concepts that was much necessary for your mains exam. Similarly, in this today's video, I am going to discuss the very important questions and the concept for the upcoming exam. And wherever I am telling that it is important, so please pay the special attention and take a note of that one, or at least take a screenshot of that one and revise at least 2 or 3 times, because it is important for your exams, right? So in this today's session, we are going to discuss again a very important and high yield questions and the concept for the mains exams. So I want every one of you to be very active in the comment box, and wherever I am throwing the question in front of you people, so please try to mention a correct answer for that one after reading the question completely, carefully, perfectly, and very perfectly. Okay? Yes. A very good evening to one and all. Good evening, beta. Good evening. Good evening. A very good evening to one and all. Welcome you all once again to the Master Nursing classes. So in this today's session, again, I am going to discuss the very important and again very important questions and concept for the exams. Let's begin the session now without wasting the time, right? So can we start the session now? Yes, can we start the session? Good evening, beta. Good evening. So for do thumbs up in the comment box. We will start the session now. Yes. If any one of you are new to the Master Nursing classes, please do subscribe to the channel. And you all are live to the session, so hit the like button. We will start the session now, and let your few of your friends also get joined to the session. And share the session with your friends and in your WhatsApp status. Okay, so your other friends also get joined, and they can also get learn from the Master Nursing classes, right? Yes. So we will start the session now without wasting a time with this powerful motivational line. Students, the best preparation for the tomorrow is doing your best and the best and again best in the today. So at the end of the day, whenever you are going to bed for the sleep, you have to be very much satisfied that I have done my everything in this today, whatever the time which was available for me, I have utilized the every minute perfectly. So you have to have that particular feeling. So then only your day will complete, right? So the tomorrow's preparation will begins today only. If you are doing everyday best, so the best result is awaiting for you, and best rank is about to come with your name. Okay? Yes. Yes. We will start the today's session, and rapidly I will tell you people. So yesterday's important assignment question what I have given to you people, a route of administration of the insulin and heparin. So I have asked in the yesterday's class, and almost 99% of you people have given the correct answer. The route of insulin and heparin administration is the subcutaneous. Very easy question and very important question. Okay, keep in your mind, right? So the second question I was asked in the yesterday's class is only insulin which we can use by the IV route. Yes, so that is the regular insulin. That is the only insulin we can use by the IV route is the regular insulin, and insulin and heparin both are administered by the subcutaneous route. Okay, so the next is best site for administration of the insulin is which one? And 99.9% of you have given the correct answer in the yesterday's class. Okay, that is the around the umbilicus, abdomen, that is especially around the umbilicus on the lower abdomen. So this is the correct answer. This is the best site for administration of the insulin. Okay, so this was the last yesterday's class assignment question. Okay, so and last question which I have asked to you people, that is the what is the gap between one site and next site of the insulin administration. Okay, so here I have given the one insulin administration in this particular site, and I am giving the next dose. Okay, so what is the gap we need to mention? What is the gap we need to maintain between the two doses of the insulin? Yes, what is the gap we need to mention to administer the insulin in between the two doses? Okay, so first dose I have given here, you consider, and second dose I need to give, yes, 1 inch away from the last dose. Okay, or we can say 2.5 centimeter away from the last dose, or the 1 inch away from the last dose. Both are same. 1 inch is equal to 2.5 centimeter. Okay. So keep in your mind. So these are the golden points what are given in the form of the assignment. So here comes to the today's question, right? Yes. Fatapat hit the like button, and we will start the today's session with a powerful uh, and very important questions for your mains exam, right? So here is the question. Whipple's triad helps to confirm the diagnosis of the which of the following condition? Yes, Whipple's triad helps to confirm the diagnosis of the which of the following condition? Option A, type 1 diabetes. Option B, insulinoma. Option C, Graves' disease. And option D is the Cushing syndrome. So what is the correct answer? What is the correct answer? Option A, type 1 diabetes. Option B, insulinoma. Option C, Graves' disease. And option D, Cushing syndrome. Yes? Almost all you people given the correct answer. That is the insulinoma goes to the correct answer. Sir, what is the insulinoma? Insulinoma is a tumor of the isolate of the Langerhans cells or the beta cells of the pancreas, where it is excessively producing the insulin. Okay, where it is excessively producing the insulin, increased insulin production. But if insulin is producing excessively, so what happens to the blood glucose level? Blood glucose level will get decreases. Okay, decreased blood glucose level frequently. Okay, if the patient is going the hypoglycemia very frequently, means the patient came today, when we check the blood glucose level, it was the 45. So we have given the correction, that is the dextrose solutions we have given to the patient, and patient comes to the normal glucose level, and he went back to home. Again next day morning he is coming with again same symptom of the hypoglycemia. Means frequently hypoglycemia is happening. Means which tumor we will suspect? Yes, frequent hypoglycemia happening means we will suspect a tumor called as the insulinoma. So we will suspect a tumor, that's what we call as the insulinoma. So this is the concept. It means strikes in your exam directly. Very important, keep in your mind, right? Sir, what is the Whipple's triad? It means, sir, Whipple's triad is a classical triad which we will see in case of the insulinoma. So it including the signs symptoms of the hypoglycemia due to the increased insulin. So there is a sign and symptoms of the hypoglycemia will be there. Along with that, there is in the plasma glucose level or the blood glucose level which goes less than 70 milligram per deciliter. And whenever we will give the correction, that is the dextrose solution, that time the symptoms will reduce, and there is the improvement with the glucose intake. Whenever the patient will intake the glucose, that time the symptoms will comes to the normal. Okay, so this is the Whipple's triad. It is very important for your exam. It is very important for your exam. Whipple's triad. Okay, so students, did you heard about the Whipple's procedure? Do you know what is Whipple's procedure? And where we have to do the Whipple's procedure? Yes. So Whipple's procedure is the name of the surgery. So that is entirely different from the Whipple's triad. Okay, Whipple's triad we will see in case of the insulinoma. But the Whipple's procedure is like this. Look at the procedure I am drawing in front of you all. It is very easy and very simple. It is very perfect. Okay, simple diagrammatic representation I will give so you people can remember for the long term. Okay, so this is your beautiful esophagus, right? And this is the stomach. And this is the duodenum. You know, head of the pancreas, where it is? The head of the pancreas is here at the C portion of the our stomach, and this is the how pancreas actually which goes like this. Okay, so this is the pancreas. Whenever there is in the tumor of the this particular head portion of the pancreas, okay, head of the pancreas tumor, that time we will remove the pancreas half, stomach half, and the duodenum half. So this particular portion we are surgically eliminating in a case of the head of the pancreas cancer. Okay, so head of the pancreas cancer happening means we are doing the duodenectomy, gastrectomy, and pancreatectomy. So all together I will call this one as the gastro duodeno pancreatectomy. So this is in simple we will call this as the Whipple's procedure. Okay, so what we call this one in simple, that is the Whipple's procedure. So this one we will do in case of the head of the pancreas tumor. Okay, so we are removing the half of the or the portion of the stomach also. We are removing the second portion of the duodenum also, and we are removing the head of the pancreas also. So this is what we call the Whipple's procedure. We will do this one in the head of the pancreas cancer. Okay, it is very simple, very important. Whipple's triad will be seen in a case of the hypoglycemia. Whipple's procedure will be done in a case of the head of the pancreas cancer. Okay, it will be done in case of the head of the pancreas cancer. So the head of the pancreas cancer is the most common site of the pancreatic cancer. Okay, you can remember this one also, very important, right? So here is the next question is awaiting for your brilliant answer in the comment box. So please do read the question carefully, completely, properly, perfectly. So then try to give the best answer in the comment box. Yes, beta stress हो रहे तो you can listen the song. There is one trending song in Kannada. Huvina Baanadanti, you know. So you can listen that song, so your entire stress will comes to the normal. Okay, all our other state peoples, if you want to reduce the your stress in a single shot, means there is a one song in Kannada you can listen at the end of this class. Okay, search Huvina Baanadante trending girl. Okay, so one new singer have arrived in our Karnataka. She's like very brilliant talent. Okay, so you can listen in one shot only. Your entire stress will comes to normal, right? Okay, so focus on the question and try to give the answer. Which of the following is an important nursing responsibility during the water deprivation test? Which of the following is an important nursing responsibility during the water deprivation test? Option A is the encouraging the patient to drink the fluid. Option B is the administering the insulin before the test. Option C is the monitoring the vital signs and sign of the dehydration closely. And option D is the giving the potassium supplements. So what is the correct answer? Which of the following is an important nursing responsibility during the water deprivation test? Students, in a two situations, we will study a two different important tests. That is, in the case of the diabetes insipidus, we will do the water deprivation test, and in the case of the syndrome of inappropriate antidiuretic hormone, there we will do the water loading test. Right? So in these both situations, we need to monitor a special thing that is very important for our exam purpose. So first, we will understand what is the water deprivation test and what is the water loading test. Before going to that one, I will tell you little a function of the our antidiuretic hormone here. So because of the antidiuretic hormone only, these particular two diseases, there is the syndrome of inappropriate antidiuretic hormone and the diabetes insipidus, both are happening. Okay, so but our antidiuretic hormone, so this is antidiuretic, means diuresis means increased urine output is the diuresis, right? So it is antidiuresis means this hormone, if it is increasing means what happens? If antidiuretic hormone increased means what happens? Yes, urine output will decreases. Simply why? Because it is in the against of the diuresis, that is the antidiuresis, right? So if the antidiuretic hormone increased means urine output will get decreases. Similarly, on the other hand, if the antidiuretic hormone decreased or the deficit you consider, okay, deficiency of the antidiuretic hormone, which leads to the increased urine output, because there is no hormone in the body, so the deficiency of the antidiuretic hormone which is not stopping the production of the urine. Okay, so production of the urine is not stopping means the urine output will be more, right? So increased antidiuretic hormone decreases the urine output, and the decreased antidiuretic hormone will increases the urine output. So this is a very basic concept, right? So if the antidiuretic hormone is increased, we call this one as the syndrome of inappropriate antidiuretic hormone. Okay, so due to the abnormally excessively increased antidiuretic hormone, so there is a lots of the group of the sign symptoms is coming. So that is what we call as the syndrome of inappropriate antidiuretic hormone. So what are the sign symptoms coming, sir? Yes, beta, urine output is reduced means the body is overloading with the fluid. Okay, so body is overloading with the fluid means weight will get increases. Weight gain is happening. Along with that, the urine output is not going means urine output is decreased. It means the metabolic waste will get accumulated in the body. So along with that, there is no elimination of the fluid So which leads to the edema in the body. Okay, edema in the body, and which leads to the hypertension in the body. So like this group of the sign symptoms which will come here, and along with this the fluid will be accumulating inside the body, means there will be a dilutional hyponatremia. Okay, so it will dilute the potassium and which will cause the dilutional hyponatremia, right? So these are the very important sign symptoms we will experience when a patient will be there with the syndrome of inappropriate antidiuretic hormone. Okay, so if in case this antidiuretic hormone is deficient, we call this one as in the diabetes insipidus. Okay, so we call this one as the diabetes insipidus, where the urine output will be excessively increased. So urine output will be excessively increased. It means there is a lots of the fluid loss is there. Means the patient will go into the hypotension. Okay, patient will go into the hypotension. Very important. Okay, and the patient mouth will be dry, and all the mucous membrane will be dry. Okay, all mucosa will be dry. Okay, so there is no edema, there is no hypertension, there is no any weight gain. Okay, so here the weight loss will happen. Here the weight loss will happen. Very, very important. And here all the concentration in the plasma will increases. Okay, so here the false hypernatremia we will experience. Okay, so false hypernatremia, actually in the urine there is excessive loss of the potassium, sodium is there, but very importantly here what happening, the fluid is excessively lost. So means the potassium is, sorry, the sodium is remaining inside the blood. So sodium is remaining inside the blood and the fluid is excessively lost. So that means the concentration will be increasing. Okay, so plasma concentration will be increased. Plasma concentration will be increased, or we can say plasma concentration increased, or we can say yes. Okay, so I will write this set. Okay, so plasma concentration increased, it means what is the viscosity of the blood, what happened, viscosity of the blood also increased. So there is very thick blood. Okay, so that's the viscosity of the blood will be increased. Okay, so but the urine will go diluted and viscosity of the blood will increase in the very important diabetes insipidus. Similarly here the urine output is less, means the concentration urine will go out. Okay, so here the urine will be very concentrated. Okay, or the increased viscosity of the urine, or the concentration of urine will increase. Okay, so very viscous or very thick urine it will go outside. Okay, so that is the very important. Along with this, here the plasma is diluted, means the plasma viscosity or the plasma osmolality, what happened here, it is diluted, so plasma osmolality decreased here. Or we can say the diluted plasma we will have in a case of the syndrome of inappropriate antidiuretic hormone. So student, what happened here, listen. In a syndrome of inappropriate antidiuretic hormone, due to the increased ADH, there is urine output is low. So we are not getting that whether this urine output is coming low because of the patient is having the less water or due to the SIADH. So what I will do now, I will tell the patient to not to have the any fluid. I will tell the patient to not to have the any fluid. Okay, so I will keep the patient nil per oral. Okay, so I am keeping the patient nil per oral and I am not giving the any fluid to the patient. So even after deprivation the fluid, okay, even after I am yes, in a case of the syndrome of inappropriate antidiuretic hormone, what happened, the urine output is decreased. So I am not getting whether this urine output is decreased due to the low fluid intake or due to the like abnormal increase in the ADH. So what I will do now, I will load the patient with the full of the fluid. Okay, so I will give the 3 liter, 4 liter of the fluid to the patient. Okay, so after that, after giving the 3 or 4 liter of the fluid, okay, so I will ask the patient to urinate, but the patient will not get urinate because here the antidiuretic hormone is abnormally increased. Okay, so in the SIADH, what happened in the SIADH? In a SIADH, abnormally there is increase in the antidiuretic hormone. So even after loading the body with the full of the fluid, the urine output will remain low only. So this is what we call as the water loading test. Okay, so water loading test will be done in case of the syndrome of inappropriate antidiuretic hormone. Very important. Keep in your mind. Okay, so like after increasing the fluid intake, the urine output will remains decrease only. Okay, so that will confirms the patient is suffering with the SIADH. Okay, so here in the diabetes insipidus, what happening, the urine output is excessively increased. So I am not getting that whether the urine output is more because of the more fluid intake or because of the less antidiuretic hormone. So I need to confirm that one. Means I will ask the patient to not to have anything by the oral. I will give the patient nil per oral. Okay. So I will not give any fluid to the oral. Okay. So here I will deprive the water intake. Means I am reducing the water intake. So water deprivation test. In the water deprivation test, what happens even after fluid restriction, the urine output will be more. So even we are not giving the any fluid to the patient, still the urine output will be more, or the patient will be having the polyuria. That confirms the diabetes insipidus. Okay. So that is the very important two tests you have to keep in your mind. So one is our diabetes insipidus and another one is our SIADH. In the diabetes insipidus, the patient will be having the water deprivation test we have to do. Okay, and in the SIADH water loading test we have to do. So this is the very important. Please do keep in your mind. Okay, so hope it is clear. And so now what I am doing, I am doing the water deprivation test. Water deprivation test means I am keeping the patient NPO. I am not giving any fluid to the patient. Okay. So here are the two situations happening. In the water deprivation test, urine output is more. The patient is having the polyuria, and intake we have stopped. So the patient is having the highest risk of the hypotension. Okay, highest risk of the hypotension. The earliest sign of the hypotension is the tachycardia. Okay, so the earliest sign, sign of the dehydration, or the earliest sign of the hypovolemia, or the earliest sign of the hypotension is the tachycardia. So here we need to assess the patient vitals immediately. Okay, monitor the vitals and especially monitor for the tachycardia and the dehydration signs closely. Why? Because the patient urine output is more and we are restricting the fluid of the patient for the test purpose. Okay, so that is the reason the main important nursing intervention goes in the water deprivation test is to assess the vitals of the patient's vital sign of the patient and dehydration level closely. So this is the correct answer. Okay, which is the very important one. Your 5-star question. Okay, so here is the next question which is coming in front of you. Yes, which of the following is the common adverse effect at the insulin injection site? So we have given the insulin injection. Okay, so this is the abdomen of the patient you consider. Okay, so here is the umbilicus of the patient, and around the umbilicus, here we are giving the insulin. Okay, so with the 1 inch gap or the 2.5 centimeter gap, right? So this is the first site of the insulin I have given. So the next site I have to give at the 1 inch or 1 inch gap. Okay, the next dose again 1 inch gap, again the 1 inch gap, again 1 inch gap, again 1 inch gap, again 1 inch gap. Okay, so like frequently I am changing the site of the insulin administration along with the proper gap I am maintaining. Okay, so if in case I am giving the morning dose of insulin here, afternoon dose also here, evening dose also here, next day morning also here, by mistakenly frequently I am giving the insulin at the single site repeatedly means here whether lipid will get accumulate or whether the lipid will get loss. Okay, so there is abnormal accumulation of the lipid or the abnormal loss of the lipid. So this one we call as the lipodystrophy. Okay, lipodystrophy is the a very important thing which happens at the site of the insulin administration if we are using the single site for the repeated administration of the insulin. Okay, so that is the reason as a primary nursing responsibility and primary nursing education we need to give to the patient with the diabetes that patient should rotate the site of the insulin injection frequently. Okay, he should not administer the insulin at the single site repeatedly. He should rotate it very frequently. Okay, so that is the thing what we need to educate. And so the gap between the two very important site of the injections we need to maintain, there is the 1 inch gap. Okay, so there is the 1 inch gap or the 2.5 centimeter gap the patient should and the patient must maintain here. Okay, so that's the very important. Keep in your mind. Sir, what is the two types of the lipodystrophy? So there is the lipohypertrophy or the lipoatrophy. Sir, I have told in this particular concept that whether the fat will or the lipid will get accumulated. So if the lipid is getting accumulation means, so that is what you call the lipohypertrophy. Okay, in the lipohypertrophy what happens? So there is the buildup of the fat tissue under the skin or the under the skin or the under the subcutaneous tissue. There is a buildup of the Very important. Lipids. Okay, so very important. So that is what we call the lipohypertrophy. And the one more thing I told, whether there may be a loss of the lipids. Okay, if there is a loss of the lipids, means we call this one as the lipoatrophy. Okay, so lipoatrophy. So these are lipohypertrophy and lipoatrophy are both are the types of the these both are the types of the lipodystrophy. Okay, so lipodystrophy is the most common adverse reaction which happens at the site of the insulin administration. So how to prevent this one? I told how to prevent this one. So for this prevention, we need to rotate site of injection. Okay, rotate the site of insulin administration very frequently. Site of insulin administration frequently, very important. Okay, so it is, I hope it is clear to every one of you, right? So it is very important and it's very clear, I think so, right? So here is the next question. Yes, please do read the question carefully, completely, and try to give the best answer in the comment box. I'm waiting for your response here. Do read the question, scenario based question for you all. A 45-year-old woman presents with a weight gain, especially around the abdomen and faces, right? And she also complains of the muscle weakness, and her blood pressure is elevated. So what happened here is there is in the 45-year-old woman. Okay, so here the 45-year-old woman, she is presents with the weight gain. So there is in the weight gain is there, especially around the abdomen and the face, where there is in the accumulation of the fat is there, where there is the weight gain is there. So that is especially around the abdomen and around the face. Okay, so that is the very important. And she also complains of the muscle weakness, right? And her blood pressure is elevated, her BP is elevated. On the examination, you notice a rounded, that is the moon shaped face. Okay, so very important. You have to notice the classical pictures. Okay, moon shaped face is there, and around the abdomen and face there is in the accumulation of the fat is there. Muscle weakness is complaining of, and the blood pressure is high, right? And she also having the a very important dorsocervical fat pad, that is the buffalo hump, what we can say. Here the dorsocervical fat pad will be there. So here the accumulation of the fat will be there. So that is what we call the dorsocervical fat pad. Okay. So where? So like what is the most likely diagnosis of this particular condition is your question. 45-year-old woman is there. She presents to your OPD with a weight gain. She is telling his weight, her weight is gain here. Okay. And especially around the abdomen and face, there is in the accumulation of the fat is there. Okay, and she also complains that her muscles are very weak, she is feeling, and her blood pressure is raised here. Okay, on the examination, you notice that there is in the rounded moon shaped face is there, and there is in the dorsocervical fat pad or the buffalo hump is there. What is the most likely diagnosis of this condition? Yes, 100%. 1000% is correct answer. All of you are giving. So that is the case of the Cushing syndrome. Okay, this is a case of the Cushing syndrome. Very important. Keep in your mind. Okay. So better what happens in the Cushing syndrome? Cushy in the head. All the steroid hormones are increased. Okay. So that is the glucocorticoid, mineralocorticoid, everything are increased. Especially glucocorticoids are increased. Okay. So here the cortisol is increased. Cortisol is increased. Cortisol is increased. Means her blood glucose in the Cushing syndrome, what happens? The blood glucose level will be very high in the Cushing syndrome. Okay, so patient will be having the high blood glucose. Means the patient will be getting diabetic here. Okay, so along with this one is the mineralocorticoid. That is our aldosterone. Mineralocorticoid, that is our aldosterone. Aldosterone also increased. So aldosterone increased means what it will do? It will reabsorb the sodium. It will reabsorb the sodium means it will reabsorb the water also. So sodium and water is reabsorbing means the blood pressure will be increased. So that is what in the question we are getting that is the a patient is having the hypertension. Okay, so where it is mentioned around the abdomen and face, and she also complains of the muscle weakness and her blood pressure. Her blood pressure is elevated. Okay, so very important. Her blood pressure is elevated. So this is the very important two things you have to understand here. The BP also high, blood sugar also high. Okay, along with this, these are the classical picture. Okay, so this is a very important image. Okay, so drawn by a very like next level artist like me. Okay, so here is the image, you can remember better. Look at the face, it is a rounded moon shaped face we have. It is more round than your more. Okay, so it is more round than in your moon, so that is the moon shape face we are getting. And here you can see dorsothoracic, like dorsocervical area, there is on the fat pads are there, so the it is looking like a buffalo hump. Okay, so or we can say the supraclavicular fat pads also we can say. Okay, and on the abdomen and on the thigh, so there are the reddish purple striations are there. Okay, so reddish purple striations are there like this. The reddish purple marks are there on the chest, lower abdomen and thigh. So reddish purple striations are there on the abdomen and thigh, so that is the very important. And the thin extremities and the weak muscles. Okay, so muscles are very weak and the extremities is very thin. Okay, and it is having the truncal obesity also. That is what we call a accumulation of the fat around the abdomen only. Okay, so this is the truncal obesity. Overall he will looks like this. Okay, so there is on the thin extremities and the very big abdomen and the buffalo fat pad. Are you able to see the fat pad here? So here, are you able to see the fat pad? Yes, so this is what we call the buffalo hump. Okay, so and the like reddish striations are there on the body. Okay, so this is what a very important, and the skin is very thin and easily breakable skin. Okay, so he is looking like this. Are you able to see? This is the big abdomen and this is the small extremities. You can see this is the small extremities. Okay, we can draw like this. Yes, so if we can draw like this, we can say this one is, this is the lemon, this is the lemon, and this is the stick. Okay, so person also looking like this. This is the lemon and this is the sticks. So we can say lemon on stick appearance. Okay, lemon on stick appearance. Where we will see the lemon on stick appearance? Lemon on stick appearance we will see in the case of the Cushing syndrome. Okay, so remember the very important classical sign. That's the moon shaped face. Okay, reddish purple stria on the abdomen and the lower thigh. Okay, thin extremities, truncal obesity, buffalo hump. So this is the very important, and the lemon on stick appearance we will get in a case of the Cushing syndrome. Okay, so that is the very important. Keep in our mind. Right, here is the next case. Yes, this is your 1000-point important question. Very again very important question. How many HbA1c visits are recommended by the normal newborn by a ASHA worker in the first 42 days of the life? Okay, so here is the normal newborn is there. Okay, so that is the home based neonatal care they are asking. Okay, so how many home based neonatal care visits are recommended by the normal newborn by the ASHA in the first 48 days of the life? Option A 3, option B 4, option C 6, option D 7. So what is the correct answer? Yes, the home based neonatal care that is recommended by the WHO. Okay, that will be done by the ASHA worker. That is the, what is the full form of the ASHA? Accredited Social Health Activist. You know, today is the day, we can say that is the ASHA workers day. Okay, normal newborn by the ASHA in the first 48 days. Okay, how many visits? Yes, well done, better. Well done. Almost all you people given the correct answer. Total 7 visits. Okay, I will go for the quick golden point chanting. Okay, on the home based neonatal care. On the home based neonatal care, I will go for the quick golden point chanting better. So schedule you can see here. So there is the home delivery. Okay, total 7 visits will be done if the delivery happens in the home. Okay, if the delivery happens in the hospital, it is depend on the two types again. So whether in the hospital, whether it is a normal delivery happened or it is a cesarean section happened. So yes, in the home delivery, there are the total 7 visits should be done by the ASHA worker. Okay, so it is the day 0, means on the day of the birth of the baby, she should visit the home. Next, day 3, then the day 7, 14, 21, 28, 36, and the 42. So total 7 visits should be done by the ASHA workers if the baby born in the home only. Okay, so that's the very important. Right. The next one, a hospital delivery in the hospital. If she underwent the normal vaginal delivery, means after the first day, second day they will get discharged. Okay, third day she will comes to the home. Third day she will comes to the home, and on the day of this she comes to home from the hospital. That day Asha should visit the home. Okay, so day 3, 7, 14, 21, 28, and 42. So total 6 visits should be done by the Asha worker here. Okay, so that's the very important. Right. The next one is. But here I am removing this particular 36. It is not there. Okay, so remember. Yes, the next one is the in the hospital LHCS delivery. Okay, so in the hospital, if the delivery happens LHCS, there is the total 5 visits. Okay, total 5 visits are there. Okay, so what are the 5 visits we have? That is the day 7, day 14, day 21, day 28, and day 42. Okay, why sir like this? In the why LHCS only 5 visits are there? In the case of the LHCS, they will keep the patient at least 3 to 4 days in the hospital, and the 5th day she will get discharged, or the 6th day she will get discharged, or the 7th day she will get discharged based on her condition, because there is a small procedure that takes a surgical incision on the abdomen. Okay, so that will be done by the obstetricians there. Okay, so yes, there is a surgery have been done, so that is the reason they will keep the hospital and the patient. If she comes day 7 to the home, so the day 7 onwards she should visit. Who should visit? The ASHA worker should visit to the home. Okay, so in the LSCS condition, 7, 14, 21, 28, 42. So the total 5 visits will be done by the ASHA workers in a case of the LSCS. In case of the normal delivery in the hospital, total 6 visits. Okay, in the home delivery, total 7 visits. That is the day 0, day 3, day 7, day 14, day 21, day 28, and the day 42. Okay, so that's very important. I am eliminating this 36. This is not here. Yes. Okay, so very important. Keep in your mind. And here is the next question. The rule of Hall's. The rule of Hall's in public health is most commonly associated with which of the following condition? So I'm waiting for your answer in the comment box. Fatapat do mention your answer. Yes, the rule of Hall's in the public health is most commonly associated with which of the following condition? Option A, tuberculosis. Option B, hypertension. Option C, malaria. Option D, HIV and AIDS. What is the correct answer? The rule of Hall's in the public health is most commonly associated with which of the following condition? Yes. Well done, beta. Well done. So the rule of Hall's is used in the case of the hypertension. Okay. So what is the meaning of this rule of Hall's? Yes, I will explain. Don't worry about this one. Okay. Rule of Hall's is very simple concept. Okay, you can remember. This is entire population you consider. This is the entire population. In this entire population, this is 100% you consider. In this one, a 50% of the people will be get diagnosis of the hypertension, and 50% will be remain undiagnosed of the hypertension. Okay, so 50% is people affected. In those 50% people, the 50% are only diagnosed and remaining 50% is undiagnosed. Okay, you consider this is undiagnosed and this is the diagnosed. Okay, so in this particular 50%, only 50% will take treatment. Okay, so this 50% will remain unaware of the treatment, and this 50% will take the treatment. Okay, so in this 50% who is taking the treatment, in that one only 50% people will take the proper treatment. Okay, so this is the total population. In this one, undiagnosed is the 50% and the diagnosed is the 50%. Okay, so in this entire diagnosed 50%, only 50% will be taking the treatment. Okay, so in that again only 50% will be taking the proper treatment and controlling the blood pressure. So this is what we call the rule of the Hall's. Okay, so again I will give with the diagrammatic representation. Okay, so consider rule of Hall's. So this is the entire population. This is 100%. In this one, only middle 50% have been diagnosed with hypertension. Okay, so and the 50% is having the hypertension, and 50% is having the diagnosis, and the 50% is taking the proper treatment, and the 50% is taking the proper treatment and controlling the blood pressure. Okay, so that's the very very important rule of the Hall's, what it's we can use in the patient with the hypertension. Okay, very very important, keep in our mind, right? So hope it is clear to everyone of you. Here's the next question regarding the TACO. Which of the following patient group is at highest risk of the developing the TACO? Highest risk of the developing the TACO. Option A. What is the TACO, sir? TACO is the transfusion associated cardiac overload. It is in the blood transfusion associated. That is the transfusion associated cardiac overload. Very important. Okay, so that is what we call the TACO. So which of the following patients are having the highest risk of the developing the TACO? Option A, young healthy adults. Option B, patients with the chronic anemia. Option C, elderly patients, those with a heart failure and the renal failure. And option D, patients with the iron deficiency anemia only. Yes, we are giving the blood transfusion in a severe anemia cases where the hemoglobin is less than 7 milligram per deciliter. Sorry, 7 gram per deciliter. So there we are giving the blood transfusion, right? So while giving the blood transfusion, which patient is having the highest risk of the developing the TACO? Yes, so the patient who is elderly, old aged, and those with heart failure, means the congested blood vessels, and the renal failure, means there is a less excretions or over congestion patients. So these patients is having the highest risk of developing the TACO. Okay, so very important. It is very very important. Keep in your mind, right? Here's the next question. Yes. What systolic blood pressure is used as a threshold in the Q-SOPA? In the Q-SOPA. Yes, what is the systolic blood pressure is used as a threshold in the Q-SOPA? What is the Q-SOPA? That is the quick assessment of the sequential organ failure. So that is the quick sequential organ failure assessment. Better we have the SOPA and Q-SOPA. Okay. So in the SOPA we will assess the lots of the components. At least 6 components we will assess in the SOPA. Okay. In the Q-SOPA we have the only 3 components. So that is what we call, this is in the quick SOPA. Okay. Q-SOPA means that is the quick SOPA. Okay. So very important. Keep in your mind. Right. So in the Q-SOPA or the quick SOPA, so we have the 3 components. That is the very important we have to keep in our mind. One is that is the quick sequential organ failure assessment. In this one we have the 3 criteria. Respiratory rate is more than 22 breaths per minute, so that is we will give the 1 point, and the systolic blood pressure is what we can say less than 100 mm per G, so again we will give the 1 point, and the altered mentation or the altered level of the consciousness where the Glasgow Coma scale is less than 15, so we will give the 1 point. So okay, that is the very very important, right? So in the quick assessment, like quick sequential organ failure assessment, if the blood pressure or the systolic blood pressure less than 100, we will give the 1 point. Otherwise it is more than 100 means we will give the 0 point. So that is the nothing will happen. Okay, if it is less than 100 we will give the point here. Okay, so that is the systolic blood pressure used for the as threshold, means the borderline for the Q-SOPA is the, that's the SVP is going less than 100, means that is the very important one we will consider. Okay, hope it is clear to everyone of you, right? Yes. Here is the next question. Yes, the nursing priority based questions. Lots of the questions were there in our prelims exam. What the nurse will do next? What is the nurse will do next? What is the nursing priority next? Like these questions will come in your exam, the repeatedly. So we have made people to get practice in our test series. Definitely, that was boosted your confidence in the exam, right? Yes. The nurse is carrying a patient admitted with the pneumonia. Okay, now already patient is got diagnosed with the pneumonia, and the patient suddenly developed the shortness of the breath. Okay, already patient is having the a condition what we call as the pneumonia. Already patient got diagnosed, and the patient is suddenly develops the shortness of the breath and the coughing. What should the nurse do next? Okay, what is the nurse's first action here? Option A, perform the comprehensive physical assessment. Option B, perform the focused respiratory assessment. Option C, complete medical administration, complete the medication administration. And option D, document the patient's history. So what is the correct answer? Listen, like the concept, you need to keep clear. So students, in the assessment types, we have the four type of the assessment. One is the initial assessment, another one is the focused assessment, and one more is the emergency assessment, and one more is the time lapsed assessment. Okay, so here in the initial assessment, when the patient will comes first time to the hospital, okay, this is the first step of the assessment. Okay, when the patient will comes to first time to the hospital, that time we will take all previous history. Okay, and we will do the complete physical examination. Okay, and we will go for the comprehensive assessment, which including the all psychological, neurological, okay, everything, right? So we will go for the comprehensive assessment. That is what you call the initial assessment. When it happens, when the patient will first time admitted to the hospital and his diagnosis is still not known. Okay, so all the previous history will take. Okay, all the like complete physical examination we will do, and the comprehensive assessment also we will do here. Okay, in the initial assessment. So that is the reason for this initial assessment we also call it the past assessment or the comprehensive assessment. But when the patient is got diagnosed with some conditions, okay, consider in our given question the patient is now got diagnosed with the pneumonia, means the patient is having the respiratory problem. So why I need to like go for the all the neurological assessment and the GI assessment and the renal assessment? There is no use. Okay, so after the diagnosis or the after the diagnosis of the case, we will focus on the problematic area. Okay, so this is what we call the problem focused assessment. Okay, what we call this one is this is what we call the problem focused assessment. Okay, so in this particular given question also, there is on the problem the patient is having the suddenly shortness of the breath and coughing. So I will not sit and I will document this thing. Okay, I am eliminating this one. Okay, and I'm completely like I will not complete the medication, then I will attend the patient. No, it is also not good one. Okay, comprehensive assessment is when the patient is first time admitted to the hospital. Okay, so already patient is diagnosed, means we will go for the focused respiratory assessment here. Okay, we will check what is the reason for the shortness of the breath, and we will start the intervention like to give the high pulse position and all. Okay, so that's the very important. Patient is getting the shortness of breath, means what is the nursing priority action? Yes, always give the high pulse position. Very important. Keep in your mind. Okay, so this will be your exam question, right? So the next is the answer for this question goes to the option B, because the patient already have been diagnosed and the patient is having the problem in the same respiratory system only. So I will go for the focused assessment here. So this is the very important one. Okay, so the next one is the emergency assessment. In the emergency assessment, so we will always focus on the airway breathing circulation. Okay, assessment which is completely focused on the airway breathing circulation. Okay, so this is what you call the emergency assessment. So we will do in case in a situation like emergency room, or in case of the casualty. Okay, or when the patient comes to the trauma center, there we will go for the emergency assessment. Okay, so that is very important, right? The next one is the time lapsed assessment. What is this one? So this is what we call the comparison assessment. Comparative assessment. What it means, sir? Yes, beta. Patient is admitted. That time I have collected all the history of the patient, right? So now before the discharging, I will compare the initial history, okay, initial problems with the current problems, and I will come to know that, okay, so what the patient have been improved. Okay, so that is what you call from the time of the admission to the time of the discharge, whatever the time the patient spent with us and the patient improved, so that one we will filter it out. Okay, we will compare the both signs symptoms at the admission time and the how the it is come to normal, so that both thing we will compare here. So that is what we call the time lapse assessment. Okay, so we will here we will give the some time. Okay, we will give the treatment, then we will assess. So this is what we call the time lapse assessment. Very important, keep in your mind, right? So these are the four type of the important assessment the examiner can ask to you people in the exams. Okay, so the next is here. How is the credit maneuver is performed? So this question may ask in your exam in the scenario based also. Okay, so how it will be asked in the scenario based? Yes. A post-operative day one patient who is admitted in your post-operative unit or the surgical ICU. From the day one, after the surgery, he didn't pass the any urine. Means there is on the post-operative urine retention is there. Right? So the patient is conscious, patient is aware, patient is active, patient is alert. Means there is no any cloudiness in the consciousness, and he came out of the anesthesia effect. Still the patient is not having the not passed the urine. That time which maneuver we have to do to bring the urine out? Yes, that time we have to go for the maneuver in a post-operative patient with the urinary retention to bring the urine out. So that maneuver name is what we call as the Credy maneuver. Okay, so what we call that one is the Credy maneuver. So that like this the question may arise in your exam. Okay, so how is the Credy maneuver is performed is the question. Yes, how is the Credy maneuver we have to perform? That is the question. Option A, applying the firm pressure over the lower abdomen to compress the bladder. Option B, massaging the lower back. Option C is deep breathing exercises. And option D is applying the cold compress over the abdomen. So what is the correct answer? Which one of the following option is the correct one? How we have to perform the Credy maneuver? Yes. A, B, A. Yes. So almost few of you have given the correct answer. That is the applying the firm pressure over the lower abdomen. Okay. So to compress the bladder. So this is how we have to go do the Credy maneuver. Okay. So just we will give the firm pressure over the bladder so that the urine may come out. Okay. This is what we call the Credy maneuver. Okay. Very, very important. We have to do this one to empty the bladder. Okay. So that is the very important one. Right. So here's the next question. This is your 1000-star important question for your exam. Yes. What is the first phase of the disaster management cycle? Students, here the two situations will arise. What is the first phase of the disaster management cycle? And the next one is, what is the first phase when the disaster have been occurred? So which phase goes first now? So this kind of the two questions will come. One is, what is the first phase of the disaster management cycle? Another one is, now disaster have been happened. So now what is the first response, or what is the first phase we have to follow? Yes, what is the correct answer? Beta, always and always remember, if the question is coming like this, what is the first phase of the disaster management cycle? First phase of the disaster management cycle is our mitigation. What is the mitigation, sir? Mitigation means, so this is the, like we are taking all the necessary actions to reduce the risk of the disaster. So that is what we call the mitigation, and to reduce its harmful effect on the like if we are facing any kind of the disaster, so its effect should be very less. Okay, so that one we are preparing well advance. Okay, so that is before the disaster we are taking the intervention to reduce the risk of the disaster and to control the impact of the disaster. We are controlling the impact of the disaster, means the bad effect which will comes after the disaster. So we are reducing the disaster and we are reducing the risk of the disaster. So this one we have to completely well planned before the disaster. Okay, that is what we call the mitigation. What is the mitigation? Mitigation is the first stage of the disaster management cycle, where we are reducing the risk of the disaster and reducing the harmful effect of the disaster. That is what we call the mitigation. Very important. Then the preparedness. In the preparedness, we have to prepare to face the situations like disaster. Like disaster have been happened, and now I am creating one new team and I am giving the like training to those new team, like you have to go for like this, you have to rescue like this. So this is not going to be a very effective intervention. So we have to keep the disaster team well in advance and in perfect train run. Okay, so completely trained disaster management team, we have to keep that one. Okay, so that is, we need to prepare well in advance to face the situations like disaster. Okay, so this will also will happens before the disaster only. Okay, so this preparedness also will happens before the disaster. Here we are planning, here we are training, and here we are improving our resources to manage the disaster activity. Okay, so that is the what we call as the preparedness of the disaster, right? So next comes to the first step after or during the disaster is the response. Okay, so first step of the cycle is the mitigation, but after the disaster have been happened, then first step is the mitigation. Okay, so sorry, the response. Okay, so where the disasters happened, so there we have to do the response. Okay, so emergency aid we need to bring there, and rescue we need to start there and immediately relieve the patients. Okay, and trials we need to active there, and we need to treat the patients immediately as soon as possible. Okay, that is what we call the response. Okay, so after the acute phase of the disaster, we will go for the recovery. Okay, this is also after disaster. Okay, so this is also after the disaster, and here there is in the rehabilitation, rebuilding and restoring of the services will happen. Okay, so very important. Then comes to the development is the last stage, which is the ongoing and continuous stage. So building the like resiliences, sustainable growth, we have to focus there by reducing the all the harmful effect of the disaster. Okay, so very important. So these are the like components of the disaster management cycle you have to remember here. Okay, so in the question, the first step of the disaster management cycle was asked. So that is the very important. Mitigation is the first step. Okay, so after the happening of the disaster, what is the first step? That is the response is the first step. Okay, so very important, keep in your mind, right? So here's the next question. Yes, a country can be benefit from the demographic gift when yes, a country can be get benefited from the demographic gift. So when it happens, option A, it happens when birth rate and the death rates are both are high. Option B, the elderly population is greater than the youth population, then it happens. Option C, the working age population is larger than the depending population. Then option D, fertility rate is below the replacement level. So what is the correct answer? Beta, this demographic gift we also call as the demographic dividend, where we also call this one as the demographic bonus. It means something good is happening here in the demographic gift or the demographic division or dividend and the demographic bonus. Something good is happening here. So what is the good here? Means here the working population or the young population is more working population or the more young population and less dependent population. More working population or the more young population is there and the less dependent population is there, means the productivity is more, the creativity is more, the income is more, the everything which is required for the country growth is more. So that is what we call the demographic gift. And our country now in a state of the demographic gift or the demographic bonus, because a young people is more in the India as compared to the old age people, right? So the young people are more means yes, they will work more, and they will work more means there is the impact on the economy, impact on the quality, impact on the society, everything will be there. Okay, so very important, right? So the demographic gift here means a working age population is larger than the dependent population. So this is what we call as the demographic gift. If in case the elderly population or the old age population is more as compared to the working population, means the like consumers are more than the creators, users are more than the creators or the makers. So that time it is called as the demographic liability. Okay, so that is not in the gift, that is the demographic liability. Okay, so very important, keep in your mind, the elderly population or the old age population is more than the young age population, or the dependents are more than the creators. So that is the what we call the demographic liability. Okay, so very important, keep in your mind. Okay, so here is the demographic stages we have, or the demographic cycle we have here. Okay, the first stage is the HS, that is the high stationary stage. Okay, so what happens in the high means more, stationary means stable. Okay, high means more, it means both birth rate also high and the death rate also high. That is what we call high stable. Okay, so 1,000 are born and 1,000 have been died, so the population remains same. Okay, so but both birth and death both are high, so that is what we call high but stationary means stable. Okay, so that is the birth rate is high, death rate is high, so that is the population growth is stable. That is what we call as the high stationary. Okay, so very important. Then comes to the early expanding, means it is started to increase and suddenly increased. Okay, birth rate is more and the death rate is less. Okay, so 1,000 are born per day and only 200 are died per day, means 800 extra remaining on the earth. Okay, so that is the what we call as the early expanding phase. Okay, so early expanding phase, here the population growth will be rapidly increases in the early expanding phase. Okay, so next one is the late expanding phase. In the late expanding phase, birth rate is low, means it started to decrease, but the death rate are very low. Okay, so the population growth is slowing down. Okay, so very important, keep in your mind, right? So now low stationary stage, in the low stationary stage means birth rate also low, death rate also low. Okay, so 20 born per day and 20 die per day, so the again the growth of the population is stable or the zero. Okay, so that is the low stationary. And the declining stage, where the birth rate is very low and the death rate is high. Okay, so the population will go less. Okay, so that is the declining stage, what we can say. Okay, so there are the total 5 pages of the demographic cycle, very important pages. The question will be asked in your exam regarding the declining stage, where the birth is happening, sorry, birth is very low and the death also high. Okay, so that like rising death. Okay, more death and the less birth, so that is the decreased population, we will say in the declining one. Okay, so along with that, the rapid expansion of the population will happens in the early expanding phase. Okay, that is the very important, we need to keep in our mind, right? So this particular demographic cycle, okay, here our India will belongs to this particular one. Okay, that is the third stage. Okay, so we are in the late expanding phase, so here the India belongs to which stage of the demographic cycle? India belongs to the late stage of the demographic cycle, where the birth rate are started to decrease and the death rate is low here. Okay, so the population growth is slowing down and India belongs to the very important third stage or the late expanding stage of the our demographic cycle, which is very important, you have to keep in your mind, right? Yes. So the next question is here. What is the drug of choice for treating the primary syphilis? Yes, we can say primary syphilis or the early syphilis, or the syphilis which is less than 1 year of the age. So what is the drug of choice for treating the primary syphilis? Better, the treatment regimen for the primary syphilis and the secondary syphilis is somewhat changed, but the drug of choice remains the one, that is the benzathine penicillin G. But the doses of the benzathine penicillin G and everything is different. But just you have to remember the one thing, that is the what is the drug of choice for this syphilis treatment. That's it. So syphilis is caused by which causative organism? Yes, and first do try to mention the answer for this question, then we will go for the next question. What is the drug of choice for the treatment of the primary syphilis? Option A, ceftriaxone. Option B, azithromycin. Option C, benzathine penicillin. And option D is the doxycycline. So what is the correct answer? What is the correct answer, beta? Yes. That is the benzathine penicillin G goes to the correct answer. This is the drug of choice for the treating the syphilis is the benzathine penicillin, and the syphilis is caused by the very good beta. That is the Treponema pallidum. Okay, so Treponema pallidum, that is the causative organism for the syphilis, and this is the sexually transmitted diseases, and it will be treated by the a single dose of the benzathine penicillin. And here is the treatment regimen. So please do understand and keep in your mind. Okay, okay. The first line drug of choice for the syphilis is the benzathine penicillin. There is a 2.4 million units intramuscular single dose I am giving here. Yes. If in case the patient is resistant, or if the patient is having the allergy to the allergy to the penicillin that time, or in case of the non-pregnant woman, so we have to go for the doxycycline. That's the 100 mg orally twice daily for the 14 days. Or we can go for the tetracycline 500 mg orally 4 times daily for 14 days. Students, the best one is the benzathine penicillin. I am giving the single dose. Okay, so that is the very important. If the patient's allergy to this one, penicillin allergy is there, then I will go for the next secondary line. That is the doxycycline and the tetracycline. Okay, so but the dose is very much different in the both. Okay, please do remember only one thing. There is the benzathine penicillin. Okay, so this is the very important for your next exam, right? So this is the very important thing what we have discussed in the today's session, and in the tomorrow session we will start with a very important questions and the concept of the like rabies and all, and pre-exposure prophylaxis, re-exposure prophylaxis, post-exposure prophylaxis. Okay, so what are the stages of the dog bite, and what are the important interventions we need to maintain in that one. So most important and the most updated content will come up in the tomorrow session. Okay, with this full energy. So please stay connected, keep motivated yourself, try to revise the important thing and focus on the high yield topic. Don't stuck in the one subject. Okay, revise all the minor and major subject together and keep on revising the things, very important. And regularly you have to give the 2 to 3 hours also for the MCQ practice. Okay, so be in a rhythm, don't break the rhythm of the MCQ practice. MCQ practice is very important. Okay, so yes, you have to read the theory, quickly revise the theory. Just you have to look up the theory. Don't get stuck in the one subject. Just you have already prelims, you have covered the theory multiple times, 2 revision, 3 revision already you have done in the prelims. Now just you have to go through. Okay, once you just turn the page, look what is there in that one. Okay, yes, this is the this one. Okay, yes, or done. The next page. Okay, just mug up like brush up thing and move on. Okay, don't get stuck and don't get read one system for the 3 hours, 4 hours, 10 hours. Okay, so that is not going to helpful now, right? So just quick revision, along with that being in the rhythm of the MCQ practice. Okay, yes, so that is the very important thing. Just you people need to do now, right? I will come up with a more important question tomorrow session again. So stay connected, keep motivated, and here will be your assignment questions. Assignment questions for you all. What is the normal fetal heart rate? And what is the normal BP in newborn? That's the blood pressure in newborn. Okay, and number of the deciduous teeth or the temporal teeth. Total number of residual or the natal teeth, what you can say. Okay, so just residual or the temporary teeth, you write temporary teeth. This is your a very important assignment for the tomorrow's class. Okay, so at the end of the video, just try to comment in the comment box. So I will come up with the answer of this particular question in the tomorrow session. We will start with this particular questions answering. Okay, so very important, keep in your mind and move on, right? So hope it is clear to every one of you. Today's class, any doubts, so just comment in the comment box. I will clear that one in the tomorrow session and I will go move on. Okay. Yes. So thank you so much for watching the video till the end. And if anyone of you are new to the session, so please do subscribe to the channel. And who all are preparing for the Norcet 10. Okay, so prelims not qualified candidates who all are preparing for the Norcet 10, please do download the Master Nursing Classes app. So where we are giving the new batch. We are starting the new batch for the Norcet 10. Very importantly, so where I am giving you people, that is the everything in the one row. That is the classes, notes, test series plus live test series. Okay, here the subject wise test series, that is the topic wise test series, everything in a one row. Okay, so that is in the Master Nursing Classes app. Okay, so the link I have given in the description box, you can download from there. And if you are still not a part of our WhatsApp group and Telegram group, you can join there. Okay, so link I have given in the description box. Thank you so much for watching the video till the end. Okay, so we will meet in the tomorrow session again. Bye bye, take care, love you all, Jai Hind, Jai Bharat.